Hello and welcome to The Explainer. Today we are diving deep into one of the most common questions in men's health, but one that's, not often talked about out loud. We're going to cut right through all the internet hype and look at what the actual medical evidence has to say.
So, to kick things off, let me ask you this. What do you think is the single most common question that urologists, the actual specialists in this field, get asked on social media?
Yeah, you probably guessed it. How can I get bigger? It's a really personal question, and it points to a concern that a lot of men have. But here's the thing. As we're about to see, this whole concern is often driven by a huge gap between what people think and what's actually real.
Okay, let's just look at the data. A massive survey of 50,000 people found something pretty incredible. While over half of men, 55%, were unhappy with their size, a staggering 85% of their partners were completely satisfied. This right here, this is what we call the perception gap, and it is absolutely key to understanding this whole topic.
So before we can even begin to talk about treatments or anything like that, we really need to set a baseline. What does the science actually say is normal? Let's get into the hard data.
So, what does the data show us? Well, after looking at tons of medical studies, the average length comes out to about 5.2 inches, or 13.2 centimeters. And it's so important to remember, this is just an average. A really wide range of sizes are completely and totally normal. Now, there is an actual clinical diagnosis called micropenis, which is for a penis measuring less than 2.9 inches. But just look at how rare this is. It only affects 0.14% of the population. I mean, it is an exceptionally uncommon condition.
And this brings us to the real issue that affects the vast majority of men who are worried about this. It's not a physical problem, it's a psychological one. It's called small penis anxiety, and it's a very real form of body dysmorphic disorder. The person's anatomy is perfectly normal, but the mental distress they feel is very, very real, and it can have some serious consequences.
Okay, so with that in mind, what about all those quick fixes and treatments you see advertised all over the internet? Let's take a look at the non-surgical options and try to separate what's actually hopeful from what's just hype.
Before we even get into the specifics, listen to this. This is a direct warning from the top experts in the field. The Sexual Medicine Society of North America says it flat out. These procedures are considered experimental and are not recommended. They're not mincing words here. Keep that in mind as we move forward.
So here's the breakdown of what's out there. Vacuum devices? The studies show they're just plain ineffective for making things longer. Injections? Absolutely not recommended. The risks are incredibly high. The only method that has any data behind it is the penile extender.
And so, what does that data for extenders actually show? Well, even with them, the potential gain is really small. We're talking about 2 centimeters on average. And that's only after months of using it for several hours every single day. That is a massive commitment for a really tiny result.
And you have to understand, these methods are not risk-free. Extenders can cause things like numbness and bruising, but injections are the real danger here. The potential complications are described as devastating and irreversible. And get this, sometimes they don't even show up for up to 40 years. That's a risk that is just not worth taking.
All right, so if the non-surgical stuff is either risky or doesn't really work, what about surgery? Let's dive into the high-risk surgical route and see what the medical literature really tells us.
So the most common procedure is something called releasing the suspensory ligament. Basically, a surgeon cuts the ligament that anchors the penis to the pubic bone. The idea is that this allows more of the internal part to hang externally, making it look longer.
But what are the actual results? Well, when researchers looked at all the studies, the findings were pretty bleak. The outcomes are generally poor, and patient satisfaction rates are very low. On top of that, a lot of the studies aren't even reported well, and all of them mention a high risk for a whole host of complications.
So this makes you wonder, right? If these procedures are so experimental and so risky, is there ever a safe way to even think about doing one? Well, the only responsible way would be inside a formal clinical trial. A real trial has an ethics board watching over everything to make sure it's safe. It has a system for tracking every single negative side effect, and it's committed to publishing all the data, good and bad, so the medical community can see the true risks and benefits.
So we've looked at all these physical interventions, and honestly, the picture is not great. Where does that leave us? Let's turn to what the evidence shows is actually the most effective treatment for this problem.
And here it is. This is probably the single most powerful takeaway from all the research. Studies show that after men who have small penis anxiety go through psychological counseling, the vast majority of them simply no longer want to look for any other treatment. The desire just goes away.
So let's just wrap this all up. The evidence is pretty clear.
For most men, the issue isn't about anatomy, it's about anxiety. Because of that, psychological counseling is the most proven, the most effective, and by far the safest treatment. All those physical fixes you see online, they're either ineffective, give you tiny results for a huge amount of effort, or they're experimental and carry serious permanent risks.
Which really leaves us with one final thought to chew on. When it comes to this whole issue, is the biggest challenge something you can measure with a ruler, or is it something measured in anxiety? All the evidence points to the latter. Thanks for watching The Explainer.